Hi everyone, I'm Patrick Foley. I'm from Labour Outlook, and I'm joined by striking junior doctor, Dr. Andrew Meyerson, who's just come directly from the picket, and he's here to talk to us about why they're fighting, the future of the NHS, and the struggle of NHS workers in general. So thank you so much for joining us, Andrew.
No problem. Thanks, Patrick. Thank you for having me.
So, as I mentioned, junior doctors are currently striking 3 days this week, and one joint day of strike action with the BMA consultants. So, I know you come from the picket line. Can you just tell us a bit about the mood of the picket line, the response you've had from the public and from other trade unions and solidarity activists?
Yeah. Again, thanks for having me. This is the sixth time that we have had to go on strike during this year, during this prolonged industrial dispute. It should never have gotten to this point. You see what happened in Scotland. The Scottish government said, we don't want strikes. We want to make sure that we can continue to treat patients well, and we can continue to treat staff well. And they recognize the deep discontent among healthcare workers, especially after the pandemic, and they came to an agreement that was amenable to the Scottish BMA. And I'm a rank and file member of the British Medical Association. I'm not on the negotiating team, and we'll have to I have full faith in the consultant committee and the junior doctor committee to negotiate with the government. But it's been I think 140 days since the consultants sat down with the health secretary and the government about pay. It's been 180 days since the juniors have discussed this. And we have a government that just does not care about the state of the health system, and that's reflected. There's mounds of evidence for this. You look at 10 years ago, the NHS was ranked the #1 healthcare system on the planet, and then look what they've done to it. We have 7.7 million people on the longest waiting list in NHS history. It's shocking that 120,000 people died on that waiting list last year, just waiting for care, and we have 500 deaths every single week in this country from delays accessing NHS emergency care. So that's people dying at home waiting for an ambulance, dying en route to hospital in a delayed ambulance, or dying in our waiting rooms because we can't see them soon enough, we can't treat them soon enough. And all of that comes down to lack of resources. The NHS is absolutely underfunded. Anybody that tells you it's not is just grossly uninformed, or they're lying. There's been 400 billion pounds that has been taken from NHS budgets over the last decade that should have been invested. And that's the reason why the French and the German healthcare systems aren't collapsing right now, because they've had that investment over that time. Whereas this government has pulled funding from NHS across the board, and they have allowed the funding crisis to get worse. They've allowed the staff crisis to get worse. They have cut tens of thousands of hospital beds, and never did anything meaningful to fix social care crisis. And so all of these problems led us into the pandemic. And so that's the reason why the waiting list ballooned dramatically during the pandemic. From approaching, I think it was like 4.7 million people on the waiting list before the pandemic. And then it just skyrocketed since. And that's because we had no resilience left. And that is an indictment of the poor health of the health system in the run-up to the pandemic. And it represents a gross failure of the government to look after public health. And so that's the context in which we're operating right now. And then you ask healthcare staff to show up and take care of patients during the pandemic, and we did our absolute best. And 2,000 of us, of our colleagues, died doing that. And so after the pandemic, now that we're trying to get the health system back on track, with a government that just doesn't want to do that. And so this is a long time in the making, that we've gotten here. And and then consider the junior doctor strikes from 2016, when a contract was imposed on us by Jeremy Hunt. And this is a person that has done enormous damage to the health system, and he's controlling the purse strings of the government right now, and doesn't want to see an end to this crisis, because they're using our labor dispute as a distraction, and to try to blame us and blame the nurses and blame all of the other NHS staff that are striking for their gross incompetence and, in my opinion, criminal great neglect of the NHS. And so when you have 13,000 UK doctors who are working abroad now, because it's just too difficult to work here, and the pay and conditions are just terrible. We're seeing hemorrhaging levels of staff, and we see on social media all the time, and we see on on the trucks that run by our picket lines, that are those billboard trucks that they display images, advertisements. Well, the Australian government is paying for those trucks to roll by our picket lines, because they're recruiting us actively, heavily, because they know how terrible the working conditions and the pay is here. And so, after the pandemic, after seeing a decade of underfunding and underinvestment, and a government that just does not care about patients, does not care about staff, and after the waiting list got to over 7 million, we voted to strike. And you see, we had our 6-month ballot, the initial one, and then we reviewed that ballot recently, and 98% of the people voting, over 70% people voting voted to strike. There's great passion about this right now, because we recognize that unless we can fix the staff hemorrhage, then we're never going to fix the NHS. We're never going to be able to deliver the patient care that we have been trained to do, that we want to be able to deliver, but we can't, because we have a government that just does not care about us, does not care about patients. And so this should never have gotten to this right now. This is our 6th time, on the picket lines, and the 7th coming up in October. And I am desperate. I'm supposed to start a shift. I was supposed to start a shift about an hour ago in A&E. And I should be there right now. That's what I'm trained to do. That's where I want to be doing. That's where I want to be working. I don't want to have to worry about this right now. But the government has put us in this position and has forced us to do this, because there's nobody else that is going to stand up to this government to tell them that what they have been doing for the last 10, 13 years has been awful for public health, has been awful for patients, has been awful for NHS staff.
A really thorough roundup there. I mean, it's quite striking that we saw the government go from clapping our NHS workers to blaming them for the crisis that we see today. And I've seen some quite good statements from fellow health campaigners, talking about minimum service levels, with the new Tories minimum service levels bill coming in, saying, well, we've already passed that. The minimum service levels haven't been reached in normal conditions, let alone strike conditions.
Exactly.
So the key, I'm guessing, the key demands then from junior doctors, it's not just about pay. Then it's about all those things you mentioned. Just on that, what are your fears for the health service if things continue the way they are, without investment, with this sort of creeping level of backdoor privatisation? What do you think is on the cards for the future of the health service if something isn't done?
Well, you can tell from my accent, I'm from the United States, and that is the extreme version of what private healthcare looks like. And I have seen friends and family who have had their financial lives destroyed by healthcare bills in the States. There are over 500,000 medical bankruptcies in the United States every single year, and 30 million people have no health insurance at all, and something like 50 million people are underinsured. So that's just terrible insurance. It's like catastrophic something that happens, and if you with this catastrophic insurance, you'll pay a massive amount of money. I think it's like £10,000 before the insurance company will kick in and pay for the rest. That's the type of situation that we're looking at if we lose the NHS. And you see the proliferation of private healthcare in this country. It's a booming market right now, and the government is holding the population hostage because they refuse to invest in the NHS. They say, oh, look, the NHS isn't working because they engineered this crisis. And the design is to push people into private healthcare. And I would love to know who is investing in these private healthcare companies, because I suspect that it happens to be a lot of people that are connected to the government that will vote for them, and they believe that it is good for economic growth, but they have no idea the type of devastation that it is going to inflict. The NHS is a beautiful thing, and I love it dearly. That's why I fight for it. That's why I speak up about it. And this doesn't come from some not some socialist dream fantasy thing. This is reality. 10 years ago, you guys had the best healthcare system, the #1 ranked one in the entire world, and then look what this government did to it. There's nothing wrong with the model that you guys have. It is the best, most efficient healthcare model that saves taxpayer money, that delivers the best results for money, and we just need proper investment. And that starts with NHS staff. That starts with a government that cares about the future, that will plan long-term, not some short-term deal. And so, the Junior Doctor Committee is negotiating for us whenever the government will come to the table. But I want to see a long-term plan for the government from the government that will actually have a meaningful impact on staffing levels in the NHS. And that's why you saw the same thing is true with the nurses strike, and the porters and the cleaners and the radiographers, and our other allied health professionals and the ambulance staff. All of us are desperate to do our jobs. We want to see a fully functioning, properly funded, properly supported NHS that can deliver for patients, so that we don't have to worry about these arguments, because we have enough of on our plate already with the difficult jobs that we have. It's just we're desperate for government that cares about it, and I think patients should care about that too. And I think that's why we're seeing massive support from the public about this. Nurses are the most trusted profession in the country. We're not so far behind, and we are just being honest with the public about the level of service that they're getting right now is unacceptable. 10 years ago, you could see your GP in 24 to 48 hours. It's now taking over 2 weeks. In A&E, you'd be seen in under 4 hours. It's now taking 15 hours in some cases. Your cancer referral 10 years ago would be in 2 weeks. It would be the 2-week wait, and now it's taking many, many months. And we have the longest waiting list in NHS history. Again, it was over 7 million before any industrial action took place. And they're using this dispute as to try to cast blame on us for all of that. But they need to own this. They need to own that they inherited the #1, healthcare system in the world, and then ran it into the ground. Now we're performing among the worst in Europe, and it's just unacceptable. And so that's why we're fighting back, because this is in all of our disputes. A lot of it is about pay, because there shouldn't be any food banks in NHS hospitals, but far too many of them are having food banks because NHS staff can't survive. That's wrong. That is absolutely wrong in any time period, but especially after the pandemic. And so that's what all of these disputes are. It starts with the pay, because we can't afford a cost of living, but then it's also about fighting for our patients and fighting for the future of the NHS. And that's why I'm personally striking, because we've seen patients come to harm far too often due to governmental neglect of the health system, things that are happening outside of our control, outside of our communities, outside of our hospitals. And it's time for NHS to fight back, NHS staff to fight back, and that's what we're doing.
Unprecedented levels of strike action from NHS staff, but like you said, unprecedented levels of public support as well.
Yeah,
I think so many people in this country will have a personal story of an NHS worker, whether it be a nurse or a doctor, who's completely impacted their life or the life of a loved one. And I agree with you that that's coming through. You mentioned a few of them just now, things like investment and tackling the staff shortages, but we have the party conference season coming up shortly.
Yeah.
So what would your key policy demands? I mean, I know you're a health campaigner as well as a striking junior doctor. So as a health campaigner, what would your key policy demands be?
So I'm very proud to march with the SOS NHS Coalition, and that's a coalition of about 50 organizations, including Darcian, including BMA, and including a bunch of other organizations that are all fighting for a vibrant, functioning NHS. And essentially we are demanding that every single that every party of government going on into this election recognize the extent of the problem, and that means that means not ignoring that we have a £10 billion a backlog of critical emergency infrastructure upgrades that need to be made. That rack concrete issue with the schools. The concrete that it's made of air, it looks like an aero bar, right? The same issue that's happening in schools with the underinvestment in infrastructure. The same thing's happening in NHS hospitals. We have hospitals that are flooding. Critical infrastructure upgrades that you could have a catastrophic failure at any point, and that desperately needs to be upgraded. And for staff working in those conditions, that's unacceptable. That represents a danger to them, a danger to the patients that they're caring for, and oftentimes you have to close a portion of the hospital to fix that, and that is having an impact on patient care. And so I want to see a recognition of the severe underfunding and the critical infrastructure upgrades that we need to make in the NHS. That's £10 billion. But then there's many other issues with the NHS. We have among the lowest number of scanners of MRI and CT scanners in this country, relative to Europe. We have a massive staff crisis. We have a massive beds crisis. We have a massive social care crisis. Those four things: funding, beds, staff, and social care. Those need to be addressed by the incoming government. But generally, it is about funding the NHS properly, recognizing the problems that we face, being honest about them, finding reasonable financial solutions to them, and there absolutely are. And then also pay restoration for NHS staff, and then also an end to this creeping privatization. Private healthcare and privatization of the NHS. There are a couple of things that have a parasitic relationship with the NHS. And so you see the growth of a lot of private hospitals throughout the country. The Cleveland Clinic just opened up a massive hospital over the last couple of years near Buckingham Palace. And that is, that represents the type of investment that you see from investors in the States wanting to come here because they see deep discontent among the people. And I don't blame people that go, to private healthcare right now because they feel like they need it, because they see that 120,000 people died on the waiting list last year. And you see far too many people that are being held hostage by this government that does not want to invest in the NHS. These people are being forced into private healthcare. And we just saw this last weekend that, upwards of, I think it was 900,000 or 1 million people in the last year have accessed private healthcare, emptying their life savings because of this. This is terrible for people's personal financial situations, terrible for their health, and it's not good for the overall health of the country. Oftentimes in these private healthcare hospitals, you will have NHS staff who are recruited, because they're paid more to go and work in these things, and it takes away from a clinician that could be working in the NHS. The answer to all of this is pay staff better, focus on the staff crisis, discuss the situation with NHS staff so that we can figure out solutions that work well for everybody, so that we can fix this crisis for NHS staff, for NHS patients, and actually improve the system. The problem is we have a government that is hell-bent on privatizing it, hell-bent on destroying this public service and creating this two-tier system where the average worker is forced to go into medical debt for the first time in this country. And emptying their life savings in order to access private care if they feel like they need to, or the alternative is just waiting for years for care. While on the other hand, you have wealthy people who go and get world-class care, rapid access care, the type of care that we used to expect and receive 10 years ago. And so we desperately need a new government that cares about the NHS, that values it, that values public health, and will fight for it. And that's what we expect from Labour. That's what we expect from other parties that are running a serious election campaign. And it's something that has been sorely lacking from the current government for 13 years.
Yeah, painting quite a terrifying prospect there, I have to say. Particularly as we're all users of the NHS, this is
us too.
Yeah. But I, for one, am glad that we've got people like you and others on the picket line fighting for the future of the NHS.
So much.
It does make a huge difference. I think we're coming up to the end of our time, but have you got any last final words to our viewers?
Well, everybody's angry about the state of the NHS right now, and if you look at how much money was spent during the pandemic, a shocking amount of money, billions of pounds. And Rishi Sunak just wrote off 15 billion pounds of funding of other things, and it shows how important it is to plan for a pandemic before the pandemic. We live in a world of, what is it, 8 billion people now, something like that. Yes, and there's going to be another pandemic. This is not going to be the first one. It certainly wasn't the first one. It's not going to be the last one. This is going to happen again. And we desperately need a government that cares about public health, that finances it, and is not going to plan for a pandemic in the middle of the pandemic. Because when you do that, when you do things, and we do this, we see this in our lives, in every aspect of our lives. If you do things last minute, it costs a hell of a lot more. But if you plan ahead, then you can use your resources well. You can put the right resources and people in place. and structures in place in order to protect people. And on an issue as important as public health, we desperately need a government that takes this seriously. And I hope that's what we will have with the next government. Hopefully, Labor or other parties that take this seriously. It is just so critically important that after 13 years of running this health system into the ground and seeing over 300,000 people dead from austerity, 225,000 people dead from COVID, we can do so much better. It is a criminal grade neglect of our healthcare system on the part of this government that we need to that we are fighting against right now, and we are not going to stop fighting until the NHS is safe.
Fantastic, thank you, Andrew. And for anyone watching, there's another round of strikes taking place from October 2nd to October 5th. So do get yourself down to a picket and show your support. Thank you.
Thanks so much.